Welcome to this episode of Exploring the Humanities, Women's Voices from the Hong Kong Polytechnic University. Our podcasts allow us to showcase the exciting and innovative work being done by our colleagues in the humanities, intersecting with fields as varied as aviation, mental and physical health, virtual reality, Gen AI, design, neuroscience. I am Renia Lopez from the Faculty of Humanities. And today we are very lucky to have with us Professor Elaine Kwong. Elaine is Associate Professor in the Department of Language Science and Technology here at the Hong Kong Polytechnic University, Faculty of Humanities as well. She's also Associate Director of the Research Institute for Smart Aging. We are really privileged to have her here with us, so thank you so much for
You're so
joining
kind,
us.
Rania. May I add, because I'm wearing another hat, which is a speech therapist. So I am trained as a speech therapist, and my research is trying to be as practical as possible to have impact on the field of speech therapy as well. So that's an add-on.
That's great because it was going to be my first question.
Yeah.
Tell us a little bit more about your background
Yeah.
and about the areas of research that you focus on now.
Sure. I'm a speech therapist, but I focus largely on swallowing or dysphagia. So actually, dysphagia is a technical term. It's a medical term for swallowing disorders. So swallowing disorders, I'll talk more about that. It's a very prevalent condition. It's not unusual, uncommon. And my research has two foci. One is to develop and hopefully validate some non-invasive assessment tool for patients, especially those in the community, to have a valid and accurate way to assess for their swallowing condition. That's number one. Number two is the diet modification for dysphagia patients, because a lot of them will require changing in their diet texture and their drink consistencies in order to make their swallows safe. So the other hat that I'm wearing is the co-chair of the Hong Kong ITSE reference group. And by ITSE is a framework that is a standardized framework for diet modification. And we can talk about that.
Yes, definitely, because you've just used a couple of terms in there that really need to be explained. But let me come back a little bit. You just mentioned that you're a speech therapist. How does this swallowing link up with speech therapy?
That's a good question. Well, speech therapists actually deal with a couple of things. Two major domains, two major areas that are of our interest will be communication and swallowing. By communication, it includes, but not limited to, speech production, language development, language production, and voice production. They are all about communication. And the other big and a little bit more segregated domain will be swallowing, because they are really anatomically very close to each other. And yes, both of them are dealt with by speech therapists.
Thanks for clarifying that. So, swallowing is something that most of us take for granted.
Yeah.
Why is it so important to study swallowing problems, and how much of a problem is this?
Well, that's a very good point. People may think that swallowing is something natural. We are born with it. It's just a natural ability that everybody is born with. But it's not always the case, especially for patients who have suffered, for example, from a stroke, from brain damage, or from any neurodegenerative disorders like dementia, Parkinson's disease. They are very vulnerable to swallowing problems. That's number one. And even though the patients or an individual doesn't have any particular medical condition, simply due to aging, their ability to swallow and their functions of swallowing may go down as well. So it's not as trivial, as not as uncommon a problem. And to give you some figures, actually in the general public, for all the adults, it could have as much as 10 to 15% of the general public who may have encountered some swallowing problems. Let alone if we look at those nursing homes, those residents in the nursing homes, the statistics can go as high as like 50 or 60%. So that's something big.
It does sound like something big indeed. So, at the moment, how do doctors check for swallowing problems? I mean, I don't think I have ever been to the doctor and been asked, do you have problems swallowing? So, how do doctors check for this?
Usually, doctors or speech therapists or other professionals may use some mainstream exam techniques for imaging, especially for imaging, because swallowing is a very internal movement. So we need to allow people to look into some internal structures. So we need imaging techniques. So the gold standard of swallowing examination will be something that we call VFSS. And that is about using some X-rays to visualize what is going on internally during swallows, and also adding some contrast agent so that the food can be seen on X-rays. That's one of the gold standard. And the other gold standard is using a flexible endoscope. So the procedure is like this. Bear with me. So we have to put a flexible endoscope through one's nostril
Nice.
and pass the endoscope through the nostrils until it reaches the back of the nose and the back of the mouth, and until we can really see what is going on in the throat. So that's the flexible endoscope technique.
Why does it have to go through the nose and doesn't it go through the mouth directly?
Sometimes we're also interested in looking at the partition between the oral cavity and nasal cavity, and that's a better way to ensure a more natural swallow and make sure we capture everything we want to see.
So basically, extremely invasive, from what you're saying, extremely unpleasant.
Unpleasant will be the word, yeah.
Mm, I'll come back to this in a minute, but I also wanted to ask you, if someone has swallowing issues, what are the implications of that? I mean, can you choke to death, for example?
Yeah, that's one of the most serious symptoms, I would say. So suffocation. You choke on food boluses, food particles, and if that go into your airway and block the airway, that could be an immediate suffocation risk. So that's number one. And choking is another risk. Choking itself has like little problems to our health, but if that choking is implying entering of food or drinks into the airway, which eventually land on our lungs, that may cause pneumonia. And that's what we call aspiration pneumonia. And that is bad, especially for elderly.
Okay, also not fun. Okay.
Mm.
So going back to the endoscopies that you were talking about, I'll imagine that you have to go to hospital for this, no?
For the X-ray technique, the VFSS, yes, it requires some radiation-proof venue to do that. That's obviously very inaccessible and not available to everyone. That's the hospital setting. But for the flexible endoscope one, actually the system could be quite portable. So sometimes we just bring the whole system to the nursing homes or to a patient's home to do the assessment. But still, it requires a lot of training and expertise to do that. So not really accessible to everyone.
So are there any better alternatives?
That's why I'm here.
Tell us.
Yeah. Uh, so in light of these limitations for the gold standards or traditional ways, we try to look at non-invasive alternatives. So ultrasound is one of the options, I would say. And by ultrasound, it's nothing rocket science. So it's just the ordinary ultrasound that we may go through during pregnancy. So one could imagine it's not hurting, it's not really uncomfortable, and it's very acceptable to a lot of patients. And it's portable. That's the point. Yeah.
So how does it work?
So basically, we put the ultrasound probe, okay, or technically it's called transducer, okay, the probe. We put it on the neck region under the chin, and by setting up the optimal frequency, optimal penetration of the ultrasound waves, the image of what is going on in the throat can be captured, and we can interpret those images and try to figure out if there's anything wrong.
So is this expensive?
I think the expertise is expensive.
Okay,
But
okay.
in terms of the equipment, There's a range, of course, but I think it's reasonable and affordable by a lot of non-hospital settings. Yeah.
So is this something that is already being deployed in Hong Kong?
Yeah, that's one of my initiatives that I'm working on. Because in the past 4 or 5 years, I've been like working on research, collecting evidence of using this relatively non-traditional technique to do it in like clinics. So we have the evidence there, and next is the translation of the evidence of the research to clinical practice. So what we have been doing in the past few years is we try to do public educations in expos. We're trying to do a lot of workshops for practicing speech therapists to teach them, to train them on using ultrasound as the assessment tool. And yeah, we're trying to publicize this as to make it become a mainstream or one of the mainstream technique in the community.
So you must be working with other medical practitioners as well, doctors and nurses.
Yeah, we've got referrals from them,
Hmm.
but a lot of the time we actually work with NGOs.
Okay.
Because they are, especially the NGOs running nursing homes or daycare center in the community, residents or service receivers, okay, the patients, actually those in need of this non-invasive assessment tool. So we work with a lot of NGO centers to provide, first of all, clinical services to them, and they also provide research subjects for us to collect more data. So it's like a win-win situation.
Okay. That sounds good. And I'll imagine that the ultrasound, you could also do it as a treatment tool. Does it work? And how would it work as treatment tool?
Yeah, I'm glad that you brought this up because, so going back to how we treat dysphagia, if I may,
Yes, please.
yeah, there are two major approaches. One is the compensatory approach. By compensatory, it means that we are not trying to improve the swallowing function. We are improving the surrounding environment, food there that they are eating or something like that. So compensatory. And the other approach will be rehabilitative. And that is when we really do swallowing exercises and tell them, teach patients how to do new swallowing movements, etc. And for the rehabilitative treatment, in order to instruct patients how to do swallowing exercise, you could understand that as learning a new sport. So you just do your swallows naturally, but in patients, that doesn't work anymore. So we have to give them new ways to do swallows. So it's like picking up a new sport. And swallowing is really internal. It's really private. So you can't see whether or not you're moving in the right way. So with ultrasound, we can see what is happening inside. And we can tell patient, for example, you should move that hyoid bone upward not for at least like 2 seconds before you let them relax, etc. So we let the patient see, and we use the ultrasound as a biofeedback to supplement our training, and hopefully they can get the new sport, the new movement more efficiently. And we found that it works like better.
So you've already done studies with a population where you have percentage rates as to the improvement of
Yeah.
these patients?
Well, actually, we've done a study like 3 years ago, and it was not on patients, it was on healthy subjects. And the hypothesis was whether it's simple. So we are comparing a traditional biofeedback tool, which is what we call SCMG. So yeah, SCMG. And we compare this, the traditional one, with ultrasound, which is an innovative one, and we compare the efficacy just in some healthy subjects. And the result was stunning. They spent comparable amount of time to learn the new sport, new technique, but the accuracy of performing that swallowing technique is much better, significantly better in the ultrasound biofeedback group. And what we are currently doing is we are replicating studies like this in patients, in stroke patients. And we are hoping the results could be like generalized to the patient groups as well.
Fantastic, really good news. But I'll imagine there's also quite a lot of training that you need to do, not the patients, but the healthcare providers. So, how many have you trained so far, and what is their response?
Well, as said, we have been working very hard to promote, to advocate for this new assessment tool. And yes, you're right, it needs some skills to operate the ultrasound system and to capture good enough images for interpretation. So we have been running workshops and seminars, webinars for practicing speech therapists and also other allied health professionals like occupational therapists, nurse, physiotherapists, something like that. And for speech therapists alone, we have already trained at least 500 plus speech therapists in Hong Kong, and we are trying to expand this network to the Greater Bay Area. So in this August, I think the Macau Association of Speech Therapists have brought their members to Hong Kong and receive some hands-on workshop, and that's number one. And we are also planning to do more trainings in China and even in Japan, Taiwan. Taiwan could be the next place.
Really good and fantastic work. And how are the students here at PolyU involved, if they are involved, and how do they react to this?
Well, there are speech therapy training programs here in PolyU at both master's level and at bachelor's level. And I am trying to get them exposed, at least, to this technique before they graduate. So, like last Friday, I have just completed a seminar which introduced the Master of Speech Therapy students to this ultrasound technique and other contemporary new swallowing assessment techniques. And I think they had fun doing that, and they are impressed because it's really a non-invasive option for clinicians like us, and it really add value to our clinical diagnosis.
Yeah. Good, 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 good. What else? What else do you do?
Um, as said, I do diet modification. Let me promote a little bit.
Do please.
So I'm not sure if the public is aware. The initiative, there's an initiative called IDDSI, the International Dysphagia Diet Standardization Initiative. So the background of having this initiative is to provide a common language for patients, for healthcare providers all over the world to use the same language. So let me give you an example. Uh, Most of the time, we will suggest or prescribe diet for dysphagic patients. For example, if they can't, they would choke on like thin liquid, thin water, we may get them to drink some thickened liquid to slow down the rate and to buy them more time for the swallow. So that's considered to be safer for them. And how thick is thick?
Indeed.
Yeah, how to achieve the desired thickness that is safe for the patient. So that's a big question. So this IDDSI or the ITSI is developed so that everyone is following the same framework. Everyone's mildly thick is the same mildly thick.
Mhm.
So that speech therapist in Hong Kong is prescribing the same thickness, the same consistency to patients in Hong Kong and also in other parts of the world. So it's like providing a common language. And I was lucky enough to have translated the framework to Hong Kong Chinese
Mhm.
and to advocate it, promote it in Hong Kong. So recently, I think the community, the society in Hong Kong is getting more familiar with this framework, and they are more aware of why standardizing the terms, standardizing the consistency, texture is important for dysphagia management.
But you mentioned diet.
Yeah.
So aside from the liquids, what other things?
Oh, yeah. Um, of course, food is a thing.
Mm.
So if we go back to the definition of swallowing, so swallowing is not just that swallow, that very short action. Swallowing actually starts with when the food enters your mouth, and it ends with the food arrives at the stomach. So it's a longer than expected
Okay.
process.
Yes, it is.
Yeah.
Yes.
So considering that, the swallowing process also involved processing of the food, chewing of the food, preparing the food bolus for the real actual swallow. And so in some patients, for example, if they have some tooth loss, if they have dry mouth, if their tongue function is not really coordinated, they may have difficulty preparing the food. Then we may have to chop it up. We may have to mince the food. We may have to soften the food, etc. So food texture is another big topic in diet modification.
And you also look into that as part of the speech therapy work.
Yeah, that's
Excellent.
one of the compensatory treatment
Yeah,
approach.
yeah, yeah, yeah. And I think this is very relevant to a lot of people. I'm just thinking of relatives I have who have problems with their teeth. And this applies to them as well. You know, they're not in a nursing home, they're
Yeah,
perfectly fine,
yeah, yeah.
but it's something that they need to take into account as
Well,
well.
actually,
Yeah.
I'm preparing for my own aging.
Yeah, and I think we need to talk and then so I can prepare as well. Tell me one thing. The Polytechnic is a strong supporter of AI. What role do you see artificial intelligence in the future of the work that you do?
Hmm. So focusing on the ultrasound assessment, okay, to be honest, is in non-invasive, it's good, it's cheap, it's accessible. Those are the plus points, right? But there are downsides. For example, the interpretation of the image may be difficult. You need training for that. And the images may not be of super high resolution. So ambiguity, it may be like unclear to some practitioners or STs. So AI is another thing that we're trying to integrate into this assessment tool and protocol so that we can get the AI to do the first tier interpretation, looking at those images at first to pick up some minute differences, perhaps, and we can get AI to quantify, for example, the timing of the swallowing movements and to measure the range of movement of the structures. Is it moving fast enough? Is it moving good enough? Is it moving long distance enough, etc.? So we're actually training algorithms to help us with the classification. So first tier means we use the AI algorithms, the models, to classify, okay, is this patient healthy? Is this patient dysphagic? Or is this patient like at risk? So that the clinician can start from there. So that's we are currently working
Mm-hmm.
on.
We've been talking about older people, but what about infants? Do they? Because I'll imagine that sometimes you might also get issues with swallowing, no, in infants. Do you
Yeah.
work with them?
Not at this point, but I know there are other experts, other researchers. Also, they're actually using ultrasound to look at breastfeeding infants
Mm-hmm.
in NICUs
Mm-hmm.
for those who may be in need and at risk. So
Yeah.
that's also applicable.
So another area, yes.
Yeah, thanks for bringing that up. Maybe my next grant proposal.
Indeed. Tell us, what has been the most rewarding part of this journey for you personally?
Um, I think I have two most rewarding parts. One is from the patients or the subjects. So even though we are not directly giving them clinical services, but the patients coming to our experiments after doing assessment on them, we won't just let them go. We will have some follow-up recommendations and let them know, okay, what could be done next. And a lot of them are really grateful about our recommendations. So they really feel that we are helping them instead of they
Mm-hmm.
helping us as a subject.
Mm-hmm.
So that's number one. And another rewarding part will be from the speech therapists. So doing the trainings, doing those publicity, public education things, I think a lot of them is starting to recognize ultrasound as a value-adding tool for their clinical practice. For example, in the community-based speech therapists, they have no imaging tools at all. So what they are currently using is observation and really clinical palpation that is really subjective. Okay,
Mm-hmm.
so by integrating ultrasound into their clinical assessment, they get more information. They have additional information to support their diagnosis and their treatment direction. So a lot of compliments, okay, if I may. Yeah, a lot of positive feedbacks are from the clinicians.
Mm-hmm.
They really value this.
Good, 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 good. And in terms of the biggest challenges, what have those been and what are they going to be?
So challenge, I think, because a big part of my research is about building and developing an AI model. So a big enough database is always a challenge. Okay, so the data collection process and subject recruitment process will never end, first of all. And also, because I'm not trained to do ultrasound, so I'm not a sonographer, obviously. And so picking up these new skills, technical skills, and also how to operate things and how to develop some new hardware and software, it's a long process and could be challenging to us. But I think I'm fortunate enough to have a lot of collaborators because especially in PolyU, we are privileged to have a lot of engineers around us,
Mm-hmm.
and they are very good at solving problems. So whenever we have problems, technical ones and hardware ones, they are here to help. So technical issues and data collection, database, they are challenges to the research.
You've mentioned the engineers. What about any other colleagues that you work with? Any other areas?
Oh,
Applied science colleagues?
currently, we work mostly with engineers. And in another study, which also involves ultrasound, we're actually working with the dentistry colleagues
Good.
in Hong Kong U.
Mm-hmm.
Because I mentioned tooth loss, I mentioned periodontal status that may affect chewing and preparation. So they are the experts that we talk to.
Yeah, interesting, interesting. And I suppose this is a great example of collaboration between completely different fields. So, yeah.
Yeah. We learned a lot.
Yeah. So, what next? Plans for the future?
Mm, I think social impact, a lot to do in terms of social impact, because as said, we are starting to have evidence, research evidence. We are trying to translate, but the reach and significance of those impact is another dimension of work that we should do. So next, we will try to, of course, train more speech therapists. That will never end. And I want to make a regular, a routine part of swallowing assessment in the community. So perhaps we can directly provide those clinical service. I mean, provide the ultrasound screening, ultrasound assessment directly to patients. That is to go beyond research subjects. And I am always hoping to have a new service delivery model. Some speech therapists in the community may not have the ultrasound system. They may not have the expertise to conduct these assessments. Okay, that's not an issue. We can deploy, we can send speech therapists with the expertise to work with them as an outreach team to work on the assessment together, work with the patients together. So I don't know, maybe a new service delivery model that integrates ultrasound, integrates other assessment modalities for the sake of management of the space.
So, for our audience out there, your mission is going to be to help us publicize this work, especially if you have any relatives who might be having swallowing problems. Let them know that this work is being done and that it
Yeah,
exists.
email to me, Google me and email to me.
This has been a really interesting conversation. Thank you so much. Do you have any final words for our audience?
Just a reminder that swallowing is not a small thing. It's really something that we have to pay attention to. And I want to remind everything that it's not only about eating and drinking, it's also about some life and death issue, plus the quality of life of a patient. So if there is any swallowing problem, if we manage it early and well enough, we are not only working on the swallowing function, we are working on the general health and also the overall quality of life of the patient and the family. So that's my point.
Thank you so much. It's been really interesting, and I've learned a lot about
Oh,
swallowing
thank you
that
so
I had no
much.
idea about. So, thank you for joining us, and good luck with your studies.
Thank you. Thank you.
Thank you for joining us on Exploring the Humanities from the Hong Kong Polytechnic University. For more episodes or information, visit our website or follow us on Spotify. Stay tuned for discussions with leading voices from the Faculty of Humanities and beyond.